Well, another day, another approach when it comes to fraud in Minnesota. The governor today proposed centralizing more of the human services in Minnesota. Lots of ideas here. They're talking about getting rid of some of the managed care organizations like Blue Cross and Medica when you're looking at Medicaid programs. Lawmakers, are they digging any of this? We'll see. I don't know. There's going to be a lot of talk about this at the legislature for sure as we are in election year. One of the things that concerns me as you have a federal focus on fraud and the state focus on fraud is what the impact on all of this is to the non-fraudsters who are doing most of the actual work in trying to help people who need help in Minnesota. So we asked Lew Zeidner, the CEO of Eosis, to join us in studio to talk a little bit about that. Lew, it's good to have you here.
Thanks. Nice to be here.
Eosis is one of the biggest behavioral health and addiction treatment organizations in the state, right? What kind of people are you helping out?
Well, most of our patients come to us because they have troubles with substance use, and oftentimes they have mental health challenges in addition to that.
When you look at sort of the federal funding, the taxpayer funding, the Medicaid side of things, how important is that into your actual operations?
It's critical to our operations. 83% of our patients are on Medicaid or the Behavioral Health Fund, which is an adjacent fund from the Medicaid. And without that kind of funding, they can't get care. So the access to care is very limited without Medicaid.
So what, when you hear things like the federal government freezing funding, how has that impacted you guys?
Well, the biggest issue right now for us is that it has an emotional impact. We work really hard to do the right thing, to help people, to be there when people need that help. And the perception that there is fraud gives one a taint to the work that we do. We work really hard to be on the right side of the rules. That's not something to be, applauding, but at the same time, we work hard at that. Last year we lost a lot of money because the rates were so low, and we weren't able to give employees any raises, despite the fact that inflation was really high last year. And they all showed up the next day to work, and they kept showing up to work because they're committed to the work that they do. And I think that's an important message in addition to all the others.
When you say the rates, you're talking about the reimbursement rates?
Correct.
So a lot of our listeners understand that when you're talking about sort of, your regular hospital visit, right? You get the bill and you see how much the Medicaid will reimburse the hospital. And we've seen hospitals like Hennepin Healthcare and HCMC saying they may have to shut down because the reimbursement rates are so low. At the same time, we have so much conversation in Minnesota about mental health and addiction. And, you name the problem, from poor performance in school for young people, for anxiety and depression, all the way up to the gun problem and the violence problem. Mental health is always an answer. But you must look at this, Lew, and say, is there a real commitment to improve the infrastructure? You've worked in this field your whole life.
Yeah.
Do you think there is that commitment?
On the positive side, we did see the legislature give us an increase in our rates last year, and for that we're very grateful. So I want to make sure that I underline that. But at the same time, I think it's important to understand that, in general, the commitment to health care for the poor is less than I wish it was.
Yeah. Lew Zeidner is the CEO of Eosis, huge behavioral health and addiction treatment organization here in Minnesota. So how do you, because I as much as I'm on a nonprofit board, I'm on the board of Second Harvest Heartland, we are very concerned about sort of this general feeling that, nonprofits are just looking to rip off the taxpayer. And I know I can speak for the organization I'm on the board. We have invested quite a bit of money in making sure we have auditing, making sure we're on the up and up. How does an organization like yours, I guess, how do you sort of prove it in a way to Minnesota taxpayers who are like, hey, we're sick of getting burned?
Right. And I think part of it, what differentiates mental health and addiction from some of the other examples that we're reading about in the media right now in terms of fraud, is that we have very strict licensure, both for our clinicians and for our facilities. So we have regular audits by Department of Health, DHS, and the regulations that we comply with are very strict. I think some of the areas of fraud that have been talked about were good ideas that were very early in their development, and they didn't have the level of regulation, the level of licensure that we're talking about for SUD. In terms of what we do is
Lou, I just want to stop you for a second, because this is the part of this whole scenario where I think people who work in the highly regulated area that you do, don't you look at some of this stuff, some of these programs that these social services kind of checks that were being handed out and think like, how in the hell do these checks get handed out to these people when you got to jump through 10,000 hoops to get legitimate services reimbursed?
I think it has to raise that question, and my sense is people have a good idea. They want to fund that good idea. And sometimes it takes a while, years at times, to get the structure around the idea that allows for the checks and balances that we need. We've been around for a long time doing substance use, doing mental health care, and there's a lot of regulation. And every year there's more regulation that we see.
Eosis is an addiction and mental health treatment services specialist. You guys are all over the state?
Correct. From East Grand Forks to Owatonna, from Stillwater to Waverly.
When you look at the number one concern that keeps you up at night, what is it?
It's access, and it's the perception that mental health care in general doesn't work.
Interesting.
And I think part of it is similar to medical conditions. It's not like a light switch that you turn the switch and now they're better.
Can't cure it.
You can't cure it with a simple implementation, and so it takes time. And there are many psychosocial issues, housing, food insecurity, safety, all kinds of issues that intersect with mental health and addiction. And so when you see people who have multiple treatments, it's not treatment failures necessarily, it's treatment evolution, and they're evolving through their mental health or substance use issues, much like you might go for multiple treatments if you had cancer. You might go for multiple treatments if you had a heart disease, and that's true for mental health and addiction as well.
Very interesting, that idea that, and you can get a little bit why people think that way, where it's like, is this sort of mental health therapy? You're just trying to get like another, it's never solved, so you got to come back for another visit, another billing, another visit, another billing. Yeah. Well, terrible, I'm sure for people who work in this system and your team, who nobody's getting rich over there working in mental health.
No. And the reality is people didn't develop these challenges overnight.
Right.
And they're not going to go away overnight. And sometimes it takes multiple iterations of care to get there.
Lew Zeidner is the CEO of Eosis. As legislators sort of, whenever you're dealing with political stuff, it's always, the political games that go on. If you could give one message to the legislators in Minnesota this term, what would you ask them?
When you create legislation, write the legislation very carefully. Oftentimes the ambiguity in the legislation, because legislators are generalists.
Of course, yeah.
They deal with a lot
it's
of
like
issues.
Me. I'm not going to come up with a mental health or an addiction policy. I don't know.
So they have a general concept, and they try to put it in words. And then DHS or the Department of Health tries to implement that. And then we as providers try to follow it. And the more specific they can be in their intent, the better we get in terms of knowing what their intent was and following it.
It's really interesting. Lew, we're appreciative of you and all of your team. I know it's thankless work, it's hard work, and you hope, I think, especially those of us who are parents, we hope that, we never need it or our kids never need it. But knowing that you guys are doing the work, I'm just very grateful for it.
Thanks. And we're all one job loss away from needing Medicaid.
Yeah, that's true. It is the danger of when you sort of say, all right, we got so much wrong with the system, we got to stop the whole system. I think you make the argument for a more surgical approach and saying, like, yeah, please, because you need the funding. Like,
Right.
let's fix the things that are wrong, but let's not throw out the whole bit.